And I will be demonstrating the anterior palpations of the hip and pelvis. The anterior superior iliac spine can be felt by palpating along the crest, and you'll feel a bony prominence here. This is also known as the ASIS. If you keep going down, you'll feel a divot, and you'll get to the anterior inferior iliac spine, also known as the AIIS. Okay. To palpate the anterior inferior iliac spine, I'm going to have the patient lying supine, and then I'm going to place my fingers around here, and you'll find the bony prominence. That's your ASIS. And if you continue down, you'll find a little divot, and then you'll find another bony prominence, which is your anterior inferior iliac spine. The sartorius originates at the ASIS, and it runs diagonally down, and it attaches at the medial knee. Okay, and the rectus femoris, it originates at the AIIS, and then it runs anteriorly down and connects. It attaches at the anterior knee, the vastus group. Okay. To palpate the sartorius, we're going to find the ASIS, and this is where it originates, and it's going to run diagonally and attach at the medial knee. The sartorius is responsible for flexion, lateral rotation, and abduction of the hip, and flexion and medial rotation of the knee. To palpate the rectus femoris, we're going to first find the ASIS, and then we're going to go distally and find the AIIS. This is where it originates, and then it runs anteriorly down and attaches at the patellar tendon. It is responsible for extension of the knee and flexion of the hip. The pubic symphysis can be found by finding the umbilicus, and then you run your fingers down until you find two bony prominences, and in between there you'll find the pubic symphysis, which is the cartilage. Yeah. To find the pubic symphysis, first you'll find the umbilicus, and then you'll run distally until you find a bony prominence.
Hi, my name is Sabrina, and today I'll be showing you the posterior palpations of the hip and pelvis. We're going to start with the PSIS, which you can find by running your fingers along the iliac crest, and it's going to be the bony prominences right here, right under L5. Next is the median sacral crest, which you can find by palpating your fingers medially until you find the spinous processes of the sacrum, which are right here. Next are the SI joints, which you can find from the PSIS and between the PSIS and the sacrum, right here. Next is the ischial tuberosity and bursa, which you can palpate inferiorly, and it's the bony prominence right here, and the bursa is going to be right on top. The gluteus maximus is going to originate from the coccyx and the iliac crest right here, and insert right down here on the femur. Next is the sciatic nerve, which is going to run from spine and through right here down the length of your leg. The piriformis muscle starts on the anterior side of the sacrum in here and inserts on the greater trochanter right here. To palpate the PSIS, have your patient either standing or prone. You're going to palpate along their back here until you find two bony prominences. Usually it's below the back dimples. The median sacral crest you can find from keeping your thumbs on the PSIS and palpating inferiorly till you feel the spinous processes right down here. The SI joint you can find by going back to the PSIS, and you can feel it along the PSIS and the sacrum. For the gluteus maximus, have your patient either standing or prone. It's going to originate along the iliac crest, which is about here, and run all the way down to their femur right here. Put your leg up on the chair. For the ischial tuberosity, have your patient put their leg up on a chair or have their knee up on a table. You're going to palpate inferiorly from here until you feel a bony prominence right down here. The sciatic nerve runs right medially to the ischial tuberosity and the femur right along here. Some patients, if you palpate there hard enough, they'll feel a tingling or numbness down their leg. The piriformis muscle is too deep to palpate, but it runs from the anterior side of the sacrum over here and attaches on the lateral head of the femur.
Hello everybody, my name is Blake Bridges and I'll be showing y'all some lateral palpations. First off is the iliac crest. It can be found by finding the ASIS, which is right here, and the PSIS, which is on the back side, and running your fingers along the crest. Alright, so next on the list is the tensor fascia lata, and it runs from the ASIS right here, and it goes distally, and it transforms into the IT band, which then attaches distal to the knee. Alright, so next is the gluteus medius. It is the most superior of the glutes. It runs from the iliac crest to the greater trochanter. And the last of the lateral palpation is the greater trochanter. It is the bony prominence on the femur, and directly sitting above that is the trochanteric bursa. Alright, to start off with the palpations, you can have your patient either standing or supine. For the iliac crest, I try to find the ASIS first and the PSIS, and they connect to make the crest. The next one is the TFL. It attaches from the ASIS and runs to about the mid-leg right here, and then it becomes the IT band going to the distal knee. Alright, to find the greater trochanter, you're going to have your patient, in this case standing. You're going to find a bony prominence, and you can find it, or you can feel it moving with external and internal rotation. Right around it, it's hard to find. Most people, you can't find it, but it's the bursa, the trochanteric bursa. And above that, attaches to the crest, is the glute medius.
My name is Christian and I'm going to be palpating the adductor group of the thigh, the adductor longus, magnus, and brevis. To find the longest, we're going to start with the pubis. The pubis is very sensitive. Okay. So to find the longest, we would go superiorly down her thigh. The longest is the long muscle of the adductor group. It's more medial than all the other ones. It would run this way. I don't want to show all her goods to you guys. So it would be this muscle right here on her inner thigh. To find the brevis, we would start at her pubis. The insertion point of the brevis is the same as the longest, the linea aspera, and then the origin is at the medial pubis. So we would find her pubis again, very sensitive spot, and then we would just go down, not as laterally as we did for the longest, but we would just come in some because it's right underneath, and you could abduct and adduct the leg, and you can kind of feel the longest. And once you feel the longest, go in a little, and that should be the brevis right here. Okay, and last we're gonna find the magnus. So what you wanna do is pull her hamstring, have her contract a little, and just try to find the hamstring. You feel it up? The hamstring muscle? Okay. So you just go superiorly some, and then once you run into another muscle, you're gonna find the gracilis. The magnus is pretty hard to find. It's actually this soft spot right here in between the gracilis and the hamstring muscle. So again, we just find our hamstring muscle, go up some until we find that other muscle, which is the gracilis here, and in between is here, the soft spot, and that would be the magnus. And that is it for the adductor group. I'll be palpating her hamstring now. What you want to do is find the ischial tuberosity. It starts there and then it goes down all the way distally to her posterior knee. So we find the bony part right here in the butt, and then the hamstring should just roll. If you run down your fingers, you can't miss it. It's pretty thick, and it goes all the way down to the back part of the knee, the posterior part. It's really thick, so again, you just find the ischial tuberosity, which is the bony prominence in the back of her bottom. It's a little hard to find. And then if you just go down inferiorly, it'll connect straight into the hamstring creep, which is here.